Hello, this video is so basic but so important, especially for you young dentists just starting out. And I think it's going to be very helpful for many dentists when you have adjacent crowns and the technician, for whatever reason, has not used a solid model to perfect the interproximal contacts, because the interproximal contacts will probably be fine on a die model. Because they're okay on a die model doesn't mean the interproximal contacts will be correct in the mouth, because that die will move a little bit. Many times when there are adjacent crowns being seated and they don't go down, and you just start adjusting, you're going to over adjust the wrong contact, and you're going to have an open contact once the crowns are seated. So let me show you how to predictably adjust the correct interproximal contact so that the crowns seat in the mouth and you don't end up with an open contact. So you'll notice the crowns seat on the die model. Now, for some reason, my technician just did not use the solid model. He knows we always use the solid model to perfect the interproximal contacts. But some of you may have this happen to you. When I seated them on the solid model, they didn't go down. So however the crowns seat on the solid model interproximally, that's the way they're going to fit in the mouth. So you can see these crowns are not going down on the solid model, which I'd used in my office to check them. My technician, for whatever reason, I think he had been out and somebody else was doing the interproximal contact part and they didn't check them. That's why you want to work with one technician, not a whole dental laboratory, but work with one technician in that laboratory for consistency. So you don't have to reinvent the wheel every time you send a case to that laboratory. You discuss with that technician how you want to do your cases regarding face bows, solid models, anything else. You can depend on it every time. Our business is a business of consistency. That's how you get things right every time. So I know they're not going to fit in the patient's mouth. We've removed the provisionals. Now this is how this is done. So you've got a prep tooth here and a prep tooth here. And you've got a a natural tooth here and a natural tooth here. The way you do this, if you're seating adjacent crowns and they don't go down in the mouth, you first place this crown and adjust the contact between this crown and the adjacent natural tooth. You get that perfect. Then you take that crown off and you place this crown. So this crown is off, and now you place this crown and you get that contact perfect. Well, you've eliminated two of the contacts. You know those contacts are perfect. So if the crown still won't go down, you know it's this contact. And you do that contact third. So 1, 2, 3. But you don't put both crowns on the teeth. You don't try to place them until you've adjusted this contact and this contact. And then this is the third one you adjust. So here are the prep teeth. Now I'm placing the back crown on the prep tooth, and I'm popping floss between the back crown, the distal crown, and the molar. Now I've taken the posterior crown off, and now I'm placing the crown on the anterior tooth, the first bicuspid. And as my assistant holds that crown down with her finger, I'm popping the floss through. And what do we want? We want just a pop with unwaxed dental floss, just a good, nice pop. But we don't want it to be so hard that you can't get the floss through. So now I know that the contacts here and here are correct. So the only contact I have to perfect now is the contact between the crowns. So I'm spraying this with a Clued indicator spray, and you see I've sprayed it on the mesial of the distal crown, of the crown on the second bicuspid. Now I'm spraying it on the distal of the crown on the first bicuspid, and it's tight. And I'm using this grinder to adjust. There'll be a little white spot in the green Clued spray, and I adjust just that spot. You don't adjust the whole contact because you don't want to wipe out the whole interproximal surface of the crown. Just adjust that white spot very lightly. Then I'm going to go to the next crown and adjust it real lightly. Then I'm going to spray the Clued on the contacts again and push them to place. Now I'm looking at the margins to see if the crowns are down, and then my assistant is going to place her finger between to hold these down, and I'm going to pop it through. And I'm going to go ahead and check all three of them and pop them through, and I need a little more adjustment, and adjust just the white spot in the Clued, and then I'm going to come back and polish it with the Shofu rubber wheels. Anywhere I've adjusted, I'm going to polish with the Shofu rubber wheels. Then I'm going to place the crowns on the teeth again, and I'm going to pop the floss through. Now I like to use unwaxed floss because it'll break if the contact's too tight. So I like to use unwaxed dental floss for checking the contacts. Now I'm trying them on the solid model again, and you can see they fit. If they fit the solid model, they're going to fit the teeth interproximally. Now you can go to the link on how to use the solid model to perfect interproximal contact. You're actually cutting away the gingival 1/4 of the prepped tooth on the stone model, and you just do that with a straight shank round burr, about a number 8 round burr. Just cut this part away so the stone of the gingiva does not keep the crown from seating. You're not using this stone model to perfect the margins or to fabricate the crown. You're only using the stone model to perfect the interproximal contact. So you want to get away from the marginal part of the prep tooth on the stone model, and you do that by cutting it away with a straight shank round burr. So now it fits on the solid model, and it fits in the mouth, which is going to happen every time. So we're going to alcohol these, wipe all the Clued off or any saliva, place Vaseline on the interproximal contacts. This is the other crown. Cleaning it with isopropyl alcohol, drying it, placing Vaseline. Now if it's an Emax or a zirconium crown, you'll treat that. You can refer to the videos in dentistrymasterclasses.com on how to treat Emax or zirconia crowns before cementation. So then apply the Vaseline only to the interproximal contact so the cement does not set up in the interproximal area. And I'm wiping the teeth again with Tublicid Red. Then we're squirting Unisim cement into the inside of the crown. You're not filling it up, you're just squirting it around the edges on the inner part of the crown. See, I'm not filling it up. Then you gently place it. Use this carrier, which is just red rope wax on the end of a cotton tip applicator. It's a very effective carrier for crowns or veneers. One and the other. Do not remove the cement until the cement has reached initial set. Do pop floss between the contacts because you don't want any excess cement setting up in the contacts, or it'll be difficult to remove. But do not remove the excess cement at the margins until the cement has set initially. Not full set, but initially, so it peels off, it doesn't wipe off. If you wipe it off, you're going to have some suck back in the microgap between the crown and the tooth, and there'll be a void in that microgap which will collect bacteria and you'll get stain, decay, and sensitivity. So you want the excess cement to peel off, not wipe off. So let it set for a little while. Not complete set, but just where it's crunchy, like crunchy snow. Now popping between the 3 contacts, pop down and pull to the side. Then you're going to hold it in place, clean it off. And when you clean off the excess cement, use the back end of a scaler. And that way you won't poke the gingival tissue. Now these are supragingival margins because it's not in the aesthetic zone. The longer I'm in practice, the more I go with supragingival margins on lower posterior teeth and maxillary second molars, because you can't see the margins. They're easier to capture accurately in an impression, and it's easier for the patient to keep clean. So this is the final side view. Check the occlusion, little occlusal adjustment, check the contacts again, remove any cement, put a knot in that floss so when you pull it side to side you'll remove any excess cement at the margin. Then this is a Shofu rubber wheel for final polish, and there we have it. So this is a method of perfecting contacts on adjacent crowns if for some reason the solid model was not used to perfect the contacts before you tried them in the patient's mouth. That's the Dental Minute. These techniques work, and they work every time. Press on the blue link in the subscription below and subscribe to dentistrymasterclasses.com if you'd like to take your practice to the top tier. There's an organized library of all the Dental Minute videos, plus many complete comprehensive cases not seen in Dental Minute videos.